Okay. All right, good morning. Thank you for joining me today. We're talking about Lyme disease because May is Lyme Disease Awareness Month. And we're talking to a patient who's gone through the process. And yeah, Karly, tell us a little bit about who you are, what you do, a little bit about your family, your life.
Well, I am a mom of two little boys, one being a special needs kiddo, wife to a veteran, and a natural health advocate, have been for like 6.5 years or so. Had been a previous patient of Dr. Ward's almost 11 years ago, and she really helped me get back on track with my diet after finding out I was gluten intolerant, and through two babies, and then life happened and hadn't seen her in a while. And then I landed back in her office about 2.5 years ago.
So what symptoms brought you back in?
So I was exhausted, like sleeping pretty much nonstop, constant fevers that were landing me in bed for days at a time, depressed, anxious, joint pain, pretty much the full gamut of miserable, with two kids at home and trying to work. And my husband looked at me one day and finally told me that I either went to see a psychiatrist or I went back to see Dr. Ward's. Those were my two options. Something had to change though.
Before you landed back in my office, what other doctors had you seen and what did they run? What did they rule out? What were they looking for?
I had been back to our primary care probably 5 or 10 times over year and a half time frame, with the exhaustion, with just not feeling like myself at all. I mean, I didn't even recognize who I was at that point. Every lab, I mean, I had stacks of lab results that were quote unquote normal, and just told that I needed to rest more. I just needed to I just needed to rest. There was nothing else they could do for me.
I don't think I realized 18 months. Like I knew it had been going on for a minute. I don't think I realized it had been going on 18 months and 5 or 10 doctor visits.
I mean, progressive. Wow. I mean, it had been progressively worse. I had had 2 bouts of the flu in that time period that just literally knocked me out in ways that, I mean, I'm a fairly healthy person. We've had a non-toxic home for 6+ years. I mean, I was working out 3 or 4 days a week, pretty hardcore, but I was exhausted.
So tell me more about that, because having a non-toxic home, I think that's important to kind of explain your lifestyle and your beliefs. And the reason why I say that is, you know, that kind of will tell us things like this could happen to anybody. Like you're a conscious health advocate, but also that's part of what you do. So yeah, tell us a little bit about that, what you mean by a non-toxic home.
6.5 years ago, we didn't quite know at that point how special needs our son was, but he was very frustrated. So for him, we had taken all of the conventional cleaners out of our house. We don't do conventional Western medicine medications unless it's an absolute last resort. We use all essential oil-based products, all clean, life-giving products from the earth. We've been a gluten-free household for 10.5 years. We've, low sugar, only natural sugars for the most part. We do, coconut sugar, honey, maple syrup. Those are the things that were in our diet. No gluten, like I said previously. We, essential oils are my go-to for any health issue we have to start. And those have always been very useful to us. That's as far as I've had to go. We've allergies, all of those things. That's where we went. Thieves Household Cleaner, my go-to, cleans everything in the house.
Yeah, so disinfects, kills viruses, bacteria, all of it, parasites, it kills. Yeah, so it's safe to say that you were living a very healthy, holistic lifestyle. Your kids are off refined sugar, you were off toxic foods, food dyes, all the junk, all the crap that, is the SAD diet, the standard American diet. Yeah, that a lot of people are on, you're very conscious about knowing, what is already healing because of your path. for yourself and your son, right? You guys were very much conscious of that.
Yes.
So going the traditional Western medicine route, you were already light years ahead of probably most of the people who walk through the door, right? Like, so when they told you to just get more rest and eat well, you're like,
yeah, that's not working.
yeah, that's my life already. And so you're working out 3-4 days a week and pretty intense, right? You were running and weights and
yes,
and things like that, like, yeah, not just a little bit of working out, like pretty fit. You're a pretty fit person, I would say. Yeah.
Right.
So when you went to the traditional Western medicine doctor, what things did they rule out? What did they look at, or did they look at anything specific?
So they told me that I may have had, they were like, you've had mono, so, you know, you'll always have Epstein-Barr. They said that they had looked for Lyme and it didn't pop up. They told me that they had looked for autoimmune diseases. They had done the full gamut workup.
Mm-hmm.
I mean, they literally said to me, you look like you're in perfect health. You just need to rest.
At that point, what was going through your mind? Did you believe them? Did you think, oh yeah, I must be going crazy? Or again,
a part of me was like, okay, I know I'm sleeping a lot, so that's not solving this problem. I know I'm eating well, but okay, maybe I need to eat more, which of course you tend to think you're eating plenty and you're not. You need to eat more. But I was eating the right things. I was eating a paleo diet for the most part. And that still was not cutting it. And so at that point, I did think I was crazy. My husband thought I was crazy, and we didn't have another option.
Yeah.
And the best thing we could have done was already knowing about you, because that's what landed me back in your door. Was like, look, I know that a pill, going to see a psychiatrist, is not going to solve this problem. There is something else going on. I can't be that crazy when I know that I spend a week on the couch and I'm not moving further. I'm not getting any better. Things are only getting worse. I mean, the joint pain went on and on and on and on, to the point where my husband wasn't tracking it until finally he looked at me and he was like, you have not been able to open a jar. You wince every time you're cutting things. He's like, what is going on? And that was a huge piece for me, that finally I was like, I can't keep living this way.
Yeah, tell me more about the joint pain, because I think that for me was and we'll talk about your first visit in a second, that for me was like, oh, okay. Yeah, tell me what it felt like. You were losing strength. Again, you worked out, so it's not like you're just a weak person who doesn't have muscle tone. But tell me, describe what it feels like, what it felt like.
So imagine you're cutting up an apple and that you have shooting pain in your hands, fingers, wrist, every joint feels like it has a knife being jabbed into it over and over again. And when you're eating a paleo diet, you cook a lot.
You're cooking everything from scratch. So you need your hands.
Right. So it was very important to me, and it was really frustrating, but it was a point of pride for me that I didn't want my husband to know that I was in that much pain. I'm like, this is crazy. Why? This shouldn't be this big of a deal. But it kept getting progressively worse, to the point when I started asking for help to chop the vegetables. Then it became obvious something was going on.
Yeah, I think that's really important to kind of touch on. Pride, right? As women, like, we're running households, we're bringing in incomes, we got the kids, we got the after school stuff, we got the job, the career, like, not to go on a tangent on what we're expected to do as women in today's society, but we're expected to do it all.
Right.
And yeah, to show weakness is hard for us. It's almost like showing failure, right? Like, I'm supposed to have this all together. I've been there. I know it's same thing. When I ask for help, like, it's DEFCON 5. Like, yeah, like it's bad. The best way I could describe the joint pain when I had Lyme, when I was 14, 15 years old, and I think that you described it really, really similar. And when I've described my pain to patients, sometimes they just, like, an emotional release, like they just start bawling because it's exactly the same thing. I described it as shards of glass scraping from the inside out of my joints.
Right.
And, like, really imagine that for people who are listening, shards of glass scraping. Like, it's not just I worked out a little too hard, I pushed it a little too hard, I'm a little achy, it's a good sore. It's like, stop you in your tracks. All I want to do is lay in a ball because it hurts so bad for days. Yeah, that I remember when you told me that, I was like, okay. So all of that, you landed in our office because you were a previous patient. It had been what, 6 or 8 years, because you were doing great.
Yeah, it had been 5 or 6 years.
Your kids were doing amazing. The essential oil regimens you guys had on you had your family on, were keeping you guys super healthy. Like life was good. Stress, you were managing it with all the oils and everything. What was that first visit like when you came back? What was it? What did we go through? What was it like?
So I brought you a huge stack of blood work, which was where I had sent it ahead of me. And I
love data. I love the data. Yep. So I said, send it.
Yeah. So I sent all that ahead, and I got to your office, and I'm pretty sure I was just in tears at that point because I felt unheard. I was super frustrated because I am not a sit and do nothing person. I go. I volunteer for the school, run a business. All of those things are who I am. I support my husband's career, keep the kids moving, do all the therapies with our special needs kiddo. I felt devastated at that point because A, I couldn't fix myself. B, I had been told I was fine when I knew I wasn't. And so when you and I sat down in that appointment, you automatically looked at me and you were like, there's a lot going on. And I went, yes.
Yeah, because I feel like I knew you at that point too, from having a past relationship. Yeah, and knew how healthy and active you live your life. Yeah.
So hearing that you had already found things and that you felt like there was a lot more we needed to dig into was a huge relief to me at that point, because I knew I was finally going to get somewhere. I knew the path was not going to be easy, but I knew good things were coming. I remember leaving that appointment and finally feeling super overwhelmed, but in a really good way. In a really good way. So when I left that appointment, I already knew I had Hashimoto's.
Because you came in with those labs.
Right. I came in with those labs, but my results were just on the edge. But for me, that edge was awful. I mean, that was my depression. And
you had all the symptoms.
Right. But because I was in the functional range of Hashimoto's, but not in a Western range, no one had said anything to me.
That's exactly the definition of functional medicine, right? It's not in a pathological range. It may not be in a disease state, but it's high enough that your body is not functioning well enough. And I feel like the more, healthy you are or cleaner your body is, the more something small out of range will and can affect you. Like you may feel it, and a lot of it can be genetics, and then there's a lot of other reasons. But why a borderline low or high thyroid you could be eliciting all the symptoms of that, and that matters.
Right.
And give it 6 more months unsupported, untreated, it's going to be out of range. You're going to have the disease. Like, why wait? Why are we waiting 6 more months when things are right there, when we can bring you back to a functional middle range? Yep. So we knew the Hashimoto's. At that point, did we do any other testing? Did we decide to do other testing?
Yeah. So at that point, you told me that you suspected that I had Lyme based on all of the joint pain and all of my other symptoms. And I had an Epstein-Barr flare that I had just come out of. There were a lot of pieces. So you did send me home with a Lyme test, which was a whole new experience, but in a really good way. And taking that test and waiting for those results, I think it brought out some anxiety, but it was also a really good but frustrating piece because I had been tested for Lyme via a blood test and told that it was negative.
Yes, I want to talk to that a little bit. So the blood test for Lyme is about 60% accurate. And there's different blood tests, but the Western blot test, I think, is the one you had through, I think, just like LabCorp, which is what most people get. And if it's positive, right, we can stop there. We don't need to necessarily go further. But if it's negative, I'm not convinced if all the symptoms align that it's negative, because Lyme and other tick-borne illnesses are what we call stealth pathogens, meaning they can hide, they can leave the bloodstream and go into lymph, go into joints, go into other parts, organs of the body, and they burrow. The type of bacteria they are spirochetes, and they spiral, so they can like go into your joints, and that's a lot of the pain. And so a blood test isn't totally accurate, and it's just not as sensitive, right? We know not all blood tests are 100%. So with most things, but most things are better than 60%. So when somebody tells me, oh, they've ruled out Lyme, I immediately say, what lab? Was it blood or urine? Like, let's talk about that. So I sent you home with, a urine test, and you had to do some prep for that urine test. You have to do a lymphatic drainage massage. So specifically lymphatic, deep tissue is okay too. So we're stirring up the bugs, we're stirring up your lymph system, we're getting all your detox pathways flushing. And then you collect the second urine after you get off the table, because that's what's been flushed. If somebody feels like crap, like they were hit with a truck, or they spike fever, or their joint pain worsens, they get flu-like symptoms after the lymph massage or deep tissue massage, I would bet $1 million it's going to come back positive, even though that test is still only about 90% accurate, 90 to 95, better odds than 60. And it's not an inexpensive test, so I don't run it lightly. I don't say, oh, it's negative, you need to do mine. It's like, oh, it's negative and you have all the pieces of the puzzle. We need to identify it, because there's also different bacterial strains that are looked at and approached differently. So we kind of need to name the bug. So yeah, that was a whole process.
Yes.
Yep. And so was that the only test? Did we do hormones at that point too?
We did hormones, I believe, shortly after that. And we've actually done more since then with huge success. Mm-hmm. So it's been a multi-pronged approach for me in that aspect. And I didn't come back with traditional Lyme either. I came back with hard tick relapsing fever. So.
And that matters on how we approach it. Yeah. And so talk a little bit about that. I remember, you don't remember having a tick bite. You didn't have a bullseye rash, which I try to drive this home in May, especially, is only about 30% of people who get Lyme have a bullseye rash, which, is old news. It's old information of, oh, well, it's not Lyme disease if you didn't find the tick and you didn't have a bullseye rash, meaning like it's got rings around it.
Right.
70% of people don't have that. The tick could have easily been in the hairline, in an armpit, in a groin. It could have attached a bit and let go before you got home and undressed and found it. There's also, this hasn't been proven by the CDC, but we also believe spiders, fleas, they even suspect mosquitoes can spread it. That again hasn't been 100% like proven. That's why they still call it a tick-borne illness, but there's blood exchange in those things. So who knows, right? We don't know where you contracted it. And that's the hard part, is people immediately rule that out. I don't hike. I'm not in the woods. I didn't get a tick bite. Your dog can bring it into your house. Like, there's so many. The other thing I think worth noting is we don't know when or where you got it. You could have gotten it when you were 17 years old and it lied dormant. Epstein-Barr virus, stress of everything happening in your life could have also brought it out from 20 years ago. Or you caught it here in Texas. That's the other thing, is it's not known as a highly populated Lyme area here. However, it is. We have a ton of deer, a ton of ticks here in the hill country. Like, I think it's an epidemic that is completely being missed.
I would agree. I've met a lot of people that have had Lyme and have had that experience, and even more so since I have learned that it's something that I deal with. And that's been really interesting, because it's just like the car that you see on the road. You never see it until you're paying attention to it. And now I feel, I went to school after working with you, and in that process of my new career, I
want to talk about, I'm really excited for that.
Met so many classmates that have dealt with Lyme and other tick-borne illnesses. And I'm like, okay, there's something more to this.
Yeah, and that's part of my mission, is bringing awareness, but also, it's more people, they say, are getting diagnosed with Lyme than HIV, and like huge things. I mean, honestly, probably as much as COVID. We don't have the numbers to confirm that because the CDC only accepts one lab, which is not the most accurate. A lot of people are diagnosed with fibromyalgia, chronic fatigue. I've seen lupus, like all of these other diagnoses, and it's really Lyme. So I think there's a lot that are being undiagnosed and a lot that are not being counted by the CDC because you had the test that the CDC would take. It came back negative. So you're not even documented in the state of Texas, in your county, in your city as a positive Lyme case. I was in Michigan in 1994 when I was diagnosed because I did come back on the less sensitive test, but that was just lucky. So, I mean, you're a perfect example of how it's flying under the radar, these numbers, because you weren't positive enough on the first test. And it's a problem. I tell most patients that come in with, oh, I have chronic fatigue, I have fibromyalgia. This is what I've had for 20 years. I immediately am like, okay, let's dig into that. Those are just sets of symptoms. Chronic fatigue is just a symptom. There is something causing it. And I find it's three things: autoimmunity, outward infections, so an inside problem of your body attacking itself, or an outside problem of an infection you acquired, or the inability to adapt where your adrenals have, completely tanked. It's usually one of those three things for chronic fatigue. You get lucky, like I've experienced over my life, you get 2 or 3 at the same time. Yeah, the trifecta, right? And then you have to just kind of dig our way out of that, taking one thing at a time, healing one, doing the right thing in the right order to heal the body, which is our process. So after you came back, we found out it was positive. Kind of walk me through what we started, how that felt for you. Did you get worse before you get better, which can happen in major infections?
So we started with more diet changes. And that was a whole new experience and one that I wouldn't change.
Yeah.
And then a different regimen of supplements. So you started supplementing for the Hashimoto's and for the Epstein-Barr. We did a round of celery juice cleanse every day for, I did at least 30 days of that. And things didn't necessarily get worse, but it took several months to start seeing the difference. My mood got better a little bit more quickly, and my exhaustion within a few months decreased significantly. But I did get an uptake of fever for a little bit, and the joint pain took quite a bit of time to recover, but within probably 6 months, I was feeling more like myself again. My brain fog was lifting, my joint pain was lifting, but I mean, I was very, very, very precise about making sure I had all of my supplements when I was supposed to have them, eating the right foods when I was supposed to. All of that mattered. And it was so important to that recovery to get back to myself. And it took some playing, we had to increase how many and what of the specific drops I was taking, and, when I took them and how often, and all of it was unique to me.
Yeah.
But it was worth the push through.
I think that's worth noting. It took months, right? To truly heal, for the cells to go through a healing process, for them to rebuild, for the infection to leave the body, for the autoimmunity to stop. It's not a one fix pill. It's not an overnight process. We have to give the body the time it needs to heal. If we can take away what it has too much of, whether that's infection, inflammation, toxins, and then put in, what the body's lacking. We did some gut healing, some hormone balancing, and we were able to collaborate and work together and use some of the essential oils you use in your life and practice. Like, hey, I have this. Yep, that'll work. Like it's very much a partnership and a collaboration to figure out. And it is, I'm joking, but not really. It is practice, right? Like that's why they call it practice.
Right.
It's not a one size fits all. It's customized and personalized to what we find in your labs, your body's chemistry. Yeah. And what works and what doesn't. So, and you were a great patient. You being in the field, you weren't messing around. You didn't halfway it. You're like, okay, I need to go off that food right now. Done. I need to take these after this during this time of the month. Done. Like that matters. You were easy to work with, committed, because you had so much on the line. Like, you wanted your life back.
Right.
Not everybody who comes in is truly ready. And a question that I ask some new patients right now, I've always asked this when I feel like I need to, are you ready to heal? Are you ready to let go of this illness? Are you ready to, to totally move on? And at first people are like, well, yeah, or I wouldn't be here. But then I think when it really sinks in, they're like, yeah, I'm ready to do what it takes. Because not everybody is. I had a patient a month ago said, I'd love to work with you and I want to do this, but like, I drink half a bottle of wine at night and I'm not ready. I'm not willing to let that go right now. And I'm like, then I can't, you're wasting your time and money. I can't totally help you. I can't move forward. And it's not forever. It's not forever. Just in the healing process, we need to sometimes change and make sacrifices, and not forever for everybody.
Right. Well, and I think that's something else that people don't realize is just because we change the way we're eating and change our supplementation, if we don't change the way we manage and deal with our stress,
totally,
it's a whole nother piece of the puzzle that, I had to reduce the commitments in my life. I had to change the way I was living, because without it, I was just going to be repeating the cycle again. And it's something that has to constantly be reevaluated. And you have said to me on multiple occasions, you're doing too much. What's going to go? And it's a good reminder to me, and to be held accountable for that space, that I'm in control and I have to make those hard decisions, because my health is worth it.
Yeah. And just so you know, you're not the only one. I recently had to check myself. 2020 has been a hell of a year for so many people that have small businesses, right? And so I had to take a step back, like, okay, there's a lot of things I was doing because I had to, and now I can let go. And where do I need to focus? Because I know if I keep doing this at this rate, it's going to be too much. My health is going to suffer. And so prioritizing, absolutely. We're the only country in the world that separates mind from body in their doctor's appointments. And we don't. What you and I do, we look at the whole body. So with that said, tell me how you're doing today. What's life like today? And then I want to roll into the training that you've done, because it just really, really brings me so much joy. So yeah, tell me kind of the progression of, you did all the things in the right order. Where are you at now?
So I haven't had another Hashimoto's flare. I eat AIP for the most part, with some things added back in. We have shifted where we source our food and how we do that. We found a local farmer that we buy 90% of our meat from, fresh eggs from his farm. He partners with a raw dairy farm. We do all those whole nutrient dense foods now. We do all organic local produce that's in season. All of those were shifts in our lifestyle that really helped me to make sure I was getting the right foods. Eating organ meat was a huge thing to help my body to recover. I've reduced back on almost all of the supplements that you put me on. I'm still on them to help my body, because they're still what my body needs to help my endocrine system, as well as manage that tick-borne disease. But I'm nowhere near. I mean, I used to be on 2 handfuls of supplements a day, and now I'm down to about a handful, if not less.
I think that's important, because my goal is not to have you dependent on XYZ herb, right? Our goal is to get your body healed. And the other thing, and able to come off that and maintain the wellness and the health. I also think, and I've been saying this a lot lately, my goal is not to get your body working at 100% capacity all the time. It's never going to be out of balance, because that's not life. Stresses come at us. We lose sleep one night, deaths, divorces, financial, it all happens. Kids, your endocrine system is going to be stressed again. Your thyroid's going to have to overwork. Our goal is to get you healthy enough to where you can deal with these stressors quickly and adapt and come back to homeostasis and be able to deal and come back. So our goal is to get your body more adaptable, more adaptive, versus you're never going to have a symptom again. That's not possible. That's just not the world we live in. And it is not to be dependent on a million supplements. It is we've done the healing your body can maintain. And I feel like you're there. How do you feel day to day?
day to day, things are like night and day. And through that journey, I have learned that, okay, it's time for me to take a step back. I need a couple days of downtime. I need to take that rest now because I don't want to be back in that place. We've been able to go back and revisit my hormones to the point where, you know, in the middle of an awful snowstorm, I was taking a hormone test because that's what I needed to do. But it's given me results that, I mean, my hormones are starting to fix. We're starting to get that piece under control because that, you know, that was a base piece that wasn't ready to be fixed yet. And now I'm able to tackle that has been a lifelong struggle for me.
Yeah. Yes. Yeah. That was kind of, that was a layer deeper. How's the joint pain? How's the fatigue? How's the mood and all of that now? The joint weakness?
Mood is most of the time, I mean, I live in a house full of boys.
Life happens.
So mood is significantly better. I would say 95% of the time, I am a much more positive, less stressed mom and wife, and able to more focus on what our family needs than being down in that really bad, dark place of just whatever. Joint pain is gone.
Yay!
I noticed that I have to, you know, take it easy on the chopping every once in a while, but that's also because I cook basically every meal we eat as a family. But I only have to, you know, take it easy now. I don't have to ask someone to come in and do it for me. So that is a huge, huge, huge piece.
And you're back working out.
Right. And I'm back doing yoga. I'm not back in the heavy, intense place I was, but I'm able to run again. I'm able to go do yoga a couple days a week. I've adjusted the type of intensity I do, and now I find much more joy in it too.
I remember when you came back and you came back and you're like, okay, so I went for a run, and I was like, okay, what happened? Like, what, are we okay? And you're like, yeah, I'm running. And I feel good. And I was like, oh, good. That tells me the adrenals, the thyroid, the infection is low, everything's balancing. So huge. So yeah, because you have two very active boys to keep up with. Yeah. And you're able to do that.
Right. Absolutely.
Awesome. So through this journey, you were already helping a lot of people with Young Living essential oils, but you wanted to do more. So kind of, share with me what you're doing now and how this, and I love this story because it's very similar to mine, right? The darkest place in your life where you're like, I'm sick, I'm not going to make it, I'm not able to do my life duties, has turned into something amazing.
So about 7 months into my healing journey, I was feeling great to the point where I felt like it was a good idea to go back to school and become a functional nutritional therapy practitioner.
Yes.
So it's now my job to help people find the right foods for their bodies. So when they find someone like you to help them, and I'm able to dig into the nitty-gritty with them and help them learn to listen to their bodies with the foods they're eating. And in addition to that, I ended up becoming an autoimmune paleo coach in addition to that, just because so many people suffer with autoimmunity and they're never told the things that they should try with food to help reduce that burden on their body, because the foods we put in make such a difference and the quality is such a big deal that we're not paying attention to that piece. So being able to help people find the right foods and balance their blood sugar and really dive into that piece of it is huge.
Yeah, totally. Right. Like, there's such a place for it. Someone may tell them to say, okay, well, you need to stop eating X, Y, Z and eat this. And they're like, okay, how do I do that? You know, because it's not a typical, again, the standard American diet, acronym STAD, right? So you're going to change, and you're helping so many people. And it's been awesome to watch this transition. And it really, there's nothing that makes my heart more joyful than to watch somebody heal and then go help others not have to suffer, not to get stuck in that traditional medical model of you're fine when you're not. That probably fires me up the most. You know your body and you know when you are not fine. So letting someone tell you you're fine or you're crazy, there's nothing that makes me more angry in the medical model than that. And you're a perfect example of, yep, something showed up. Look, guys, like this mattered.
Well, and I think it was interesting to go back to a Western medicine practitioner after that and say, look, I really appreciate what you did for me, but these are the things that came up. And I really hope that in the future, you will encourage patients to dig further. And they actually said to me after that, they were like, you know what, whatever you need us to do, we're happy to do so. Because we know we can see the difference in what has happened with you. And I think that is a big deal. And finding that Western medicine practitioner that helps you, not that continues to say it's crazy, is really important. And I think people need to remember to advocate for themselves in that way and not just take it.
Totally. And good for you for going back and like bringing that to their attention in you're, obviously well-spoken in a graceful way, like you weren't combative about it, because I think they probably really received it. And you're right. Sometimes we need a Western medicine person on our team to run certain labs or to do certain referrals, right? If somebody's really needing that, and we want to work together. We're not going to fight against them. But if they're not believing something's wrong, it's really hard to make that happen. So really good job. Like that's awesome that you were able to go back and do that and they received it. So awesome. Any other thoughts you want to just talk about your journey or give anybody any advice, especially May, again, being Lyme Disease Awareness Month? You were misdiagnosed with being told you weren't Lyme. Any last thoughts, last words of advice, anything you want to say?
Always advocate for yourself. We advocate for everyone around us, but we really have to take a step back and remember that if we don't advocate for ourselves, we aren't going to continue to be able to advocate for those around us. And don't take no for an answer.
Ooh, good one, 100%. And if people are trying to change their diet, they're trying to learn how to, eat differently and don't know where to start, how can they find you?
You can find me on Instagram at karly.workingnatural. You can also find me at Working Natural Wellness on Facebook or my website at workingnaturalwellness.com.
Awesome. Hey, thank you for meeting with me from our busy schedules, your busy boys and career. And again, I'm so happy that we took this journey together and that you're doing amazing. And thank you.
Well, thank you for everything that you've done and always being there to not just take the standard answers. It's a huge piece that I would not be where I am right now without you. So I really, really appreciate you always having that faith in me.
Oh, thank you. It is my mission, especially for women. Awesome. Thank you so much. Do you want to start?